Hey guys, it's Dr. Gonzalez again, and this is Module 8, Educating Your Clients, Tips and Tricks.
This program is brought to you by Trudell Animal Health.
Most cases of respiratory illness are going to require some degree of supportive care and therapy at home, with more cases requiring long-term management to ensure the patient remains comfortable and maintains a good quality of life. Thus, it is very important that the owner is properly equipped with the knowledge of the disease and what to monitor for, in addition to the support needed for a successful transition and care of their pet at home. Considering the limitation in our traditional in-office communication, the method utilized for communicating with this client must be expanded as much as possible so that they still feel a sense of support and ability to contact the medical staff if needed. Establishing clear targeted goals and a clear follow-up plan is crucial for compliance. It's important to involve your nursing staff so that they not only build an understanding of the case and goals of therapy, but build a relationship with the client. There is inevitably going to be a time when the client contacts the office and you're unavailable, and having a second go-to person that the client knows and trusts can be immensely impactful. There are many things that owners can do at home to supplement the care that they are providing to their pet when dealing with chronic respiratory ailments, such as an adult nebulizer can be purchased from the local pharmacy or drugstore, which will provide moisture and soothing therapy to the airway. It also helps with breaking up any airway mucus or debris still present. Nebulization is much different than humidification, as it produces water droplets that actually reach the lower airways and alveoli, versus humidification is essentially just water vapor that contacts the upper nares. An air purifier could be considered to eliminate as many pathogens as possible in the air that could potentially irritate the patient's airway. In addition, the cleanliness of the patient's immediate environment is important for avoiding respiratory irritation any further. This includes clean bedding, the avoidance of new carpet cleaners, smoking, and use of incense. The owner should consider use of canned food instead of dry food. Patients with respiratory disease may have a decreased ability to smell, and canned food can be heated and be considered more odorous and potentially more palatable to the patient. Patients should always be exercised when dealing with a debilitated respiratory patient. This includes when ambulating, eating, or administering medications, which at times can be frustrating. Encourage the owner to be selectful on supplements implemented in their patient's care at home. While supplements have their place, many times owners may go a bit overboard and purchase every supplement available. This may in fact cause more negative effects, as it induces more stress to the owner to administer all these additional medications and actually imposes more stress on the patient. Weight control is going to be very important for these patients long term. So being mindful of diet and a delicate balance of allowed physical activity is important as well. The modification of exercise and physical activity allowed becomes important to not exacerbate the patient with compromised airways, especially when it gets warm outside during the spring and summer. Patients should utilize a harness at all times, as the use of a collar and leash can be more irritating, especially to the cervical trachea. Having the owner record logs of respiratory rates at home or abnormal episodes, and even record videos of these abnormal episodes are important, as it provides you a clear ability to see what exactly the owner is describing, and it removes that sense of insecurity and stress placed upon the owner to have to remember and accurately describe and interpret the event. Considering the limitation in our traditional method of client communication, we need to adapt newer methods of communication that provide the same sense of reassurance, expertise, and transparency, so that the client still feels a sense of support and trust. There are clients that I've been working with for 6 months now that I have yet to meet in person. And yet every time we speak, I expect them to agree to a medical plan, and I have to be able to convey that sense of trust and that sense of I know it's best for their pet without ever having interacted with them. It's amazing how you forget the importance of phone communication. Even things that you communicate in person, you have to say totally different over the phone because the body language is not present. The ability to read someone's tone or how you say certain things, all that's completely absent without a person, a face-to-face interaction. You have to be amenable to doing even web chats. That's actually been one of the greatest advantages, I think, of this experience, not being able to see people in person, is web chatting. Being able to show them, here's the hospital, areas that they normally wouldn't have been able to go into before. Now they actually have a first-hand view at the ICU, at the isolation room. It gives them a better sense of inclusion. Actually, that's a big factor of what clients want nowadays, is to feel like they're included and to feel like they know what's going on. As we're so limited and excluded from so many other things that we feel like we don't have control of. So when we're establishing clear goals with our clients, we want to make sure that we set not only immediate goals, but also long-term follow-up goals. And that follow-up plan is going to be crucial for compliance. If there's nothing that the owner has to target or work up to, there's going to be no compliance with medication administration, with physical therapy, with any other supplemental care, which is only going to inhibit the patient's overall success at home. Making sure you set and confirm that recheck appointment or whatever the follow-up plan is going to be with that client prior to discharge is going to be essential to be sure that compliance and follow-up is achieved. If that client leaves, there's a higher chance that then we're going to be calling and trying to schedule an appointment after the fact, which likely is going to be unsuccessful. At the same time, it's important for you to educate and grow your nursing staff. Use them to their fullest technical capabilities. It's impactful not only on patient care, but on client relations, as your nursing staff is likely going to be the first face that the pet sees, and also going to be that interface between the client and your pet while it's in the hospital. Between the client and their pet while it's in the hospital. Advancing your team allows them to better serve not only your clients, but also any questions and guidance moving forward. There's inevitably going to be a time when the client contacts the office and you're unavailable. And having a second go-to person that the client trusts can be very impactful in those situations. And with that, that's the end of Module 8, Educating Your Clients, Tips and Tricks. Congratulations! This concludes the Master Course in Respiratory Disease Management, brought to you by Trudell Animal Health. The next step for you is completing the certification process by passing a quiz. In the comments below, you will see a link to this quiz. Once you pass the quiz, you will receive a certificate of completion and another link that will direct you to the tools to celebrate, recognize, and share your accomplishment. If you have any questions, please email hello@myvetcandy.com. Thanks again for watching.